Hello everyone and welcome to Module 2. So for today and for this week we are focusing on the topic of ophthalmology, and in your books with your Mind Tap activities that's going to be a couple chapters that we're looking at. The first chapter is going to be chapter 11. And then you'll also have to look at chapters 25 and 52, but those are for your activities, not necessarily for the eye. So let's get in and talk about this topic and some of the other pieces with it. So for this model, again, we're looking at the eye. So I want to discuss and start the discussion with the eye and the structure of the eye itself, as well as the diseases associated with the eye. The eye is a spherical-shaped fluid organ composed of structures that facilitate vision. Those structures are the cornea, pupil, lens, and retina. The nervous system also plays a very large role in our sense of vision. The nerves of the eye help to control the amount of light entering the eye through the pupil. It helps to focus the light on the retina by using the lens, and it helps to transmit the resulting images from the retina to the brain. So now let's start talking about some of the actual structures of the eyeball itself. The eyeball itself is housed in the cavity of the skull called the orbit. The eyeball is then divided into two cavities, the front and the back. And the surface of the eye is actually made up of three layers. The outer layer is called the sclera, which is this right here. The middle layer includes the corcoids, iris, lens, and cellular body. So all these guys up here in the middle. And then right back here in this inner layer is where we have the retina. And beyond that, there are external structures that are associated with the eye. Those structures serve as a way to protect and support the eye. Those are your eyelid, conjunctiva, lamicular apparatus, and extrinsic eye muscles. So now that we've talked about the structures, it's time to start talking about some of the common diseases. You have things like astigmatism. This is a condition caused by an irregularity in the curvature of the cornea and the lens. It's characterized by blurry vision and could also have squinting and headaches. This is generally treated with glasses and or contacts to reshape the cornea. We have something called cross eye or wall eye. This is a condition where the patient may have problems with depth perception and double vision. And again, treatment would be glasses or contacts, but also it would be wearing a patch over the stronger eye to force the weaker one to become stronger. And if that doesn't work, there's also the option of surgery. Myopia is also known as nearsightedness, meaning the patients have difficulty seeing things far away, but they can see things close up. Hyperopia is the opposite, that is farsightedness. It means the patients have a difficult time seeing things close up, but can see far away. And the last one we have is called presbyopia. Now, presbyopia is similar to farsightedness, but it's directly related to the aging process because we start to lose the elasticity in our eyes and our eye muscles. So now that we've talked about structures and we've talked about some common diseases, I would like to take just a few minutes and talk about ophthalmology itself, the actual care or the study of the eye. This is a branch of medicine that deals with the structure, function, and diseases of the eye. The providers that you could work with in this field are an ophthalmologist or an optometrist. Now, an ophthalmologist is a medical doctor who can perform exams and surgery, and they can also prescribe medications, glasses, or contacts. Where an optometrist is a technician who specializes in the grinding of lenses and preparing glasses or contacts. There are a number of different types of exams that we can use to diagnose and treat vision problems, and most can actually happen right in the primary care office, such as routine screening exams for vision. When doing these exams, it's really important that for the provider and you, that we also make sure that we check the patient's pupils. When we're looking at their pupils, and if everything is normal, we'll use the acronym PERLA. That's pupils equal, round, and reactive to light and accommodations. Some of the other abbreviations that we'll use in this unit are going to be OD for right eye, OS for left eye, and OU for both eyes. So when a medical assistant is doing an exam, or the provider is doing a vision exam, what we're doing is we're checking visual acuity, or clarity of vision. Normal visual acuity is 20/20, and as a medical assistant, you are responsible for assessing visual acuity, such as distance acuity, near vision acuity, and color vision acuity. So let's go ahead and look at each of those pieces individually so we get a better understanding of what each one of those is. Distance acuity is measured using a Snellen chart. This chart places largest symbols on the top line, and each line after is decreasing in size. Patients will stand 20 feet away and read each line. The result is the last line the patient can read without squinting or making any mistakes. If you have a child who is 5 years or younger, they actually get to move 10 feet away from the chart instead of the 20. And we actually would change that charting to a more kid-friendly one. And when you're trying to read or understand the results are always written as a fraction. So for example, 20/30 or 20/60 that you see on the screen there means that the patient can read at 20 feet what others would read at 30 feet, or in 20/60, 60 feet. Next test is the near vision acuity. This is done when the patients have problems reading or performing tasks close up. This type of testing is done with a Jager card. The patient will read the card held at a normal reading distance, usually 14 to 16 inches away from them. The card has a series of paragraphs that are decreasing in size. And the patient's result will be the number that is listed above the last paragraph they can easily read without any squinting or errors. J2 is actually what will be considered 20/20 or normal near vision. And our final testing is the color vision test. This will be used to test the inability to distinctly differentiate colors of the spectrum. Defects in color vision are either from birth, meaning you're born with it, inherited, or acquired through some sort of disease or injury. This test that we use is called the Ishihara test. It's a printed book or card with single color dot illustrations containing a number, a curved line, or a shape. The patient is shown 14 cards and must correctly identify 10 of them to be considered having normal color vision. Most people don't know this, but color vision is more prominent in males than it is in females. So most men actually have some form of color blindness, Some of it is very minor, but some of it actually is quite extensive. Now, along with doing some visual testing for acuity, medical assistants are also responsible for doing eye irrigations or installing eye medications. With the eye irrigation, this is where you will rinse the eye to remove any foreign substances or chemicals that are in the eye. This requires the use of sterile techniques and equipment. You will have the patient sit or lie down, but technically it is easier if the patient is laying down, tilting their head to the affected side so that the affected eye is downward, as you see in the picture. If the patient's eye, the infected eye, was on the top, there's a fear that while you irrigate, the chemical or substance would actually go into the other eye. So their affected eye should be downward so that it does not run into the other eye. The patient will you as the medical assistant will open the patient's eye like you see here in this picture with the thumb and index finger of your non-dominant hand. You'll actually end up pulling on both sides of the lid. And what you'll use is just sterile water to irrigate the eye. And you'll continue this method until the substance is either removed or the patient states that they are actually feeling better. This is very difficult because patients don't like to keep their eyes open, and medical assistants don't want to feel like they're hurting the patient by holding that eye open. But remember, you're doing this to actually help the patient, so as best as you can, keep that eye open. Also, you would be wearing gloves in this procedure. I noticed in the picture there that they are not, but you would be in the actual office. And the last one is going to be doing the installation of eye medications. This is something that as a medical assistant you may perform, or it would be an instruction to the patient on how they can do it themselves. It's similar to the eye irrigation, but patients will actually sit with their head tilted back and then look upwards. If they do that, it actually gets their eye out of the way and it makes it a little bit easier to put in the gel, the cream, or the drops. The medical assistant will then pull down the lower eyelid, making a sort of pocket for the medication to go into. And then hold the dropper, the ointment tube, or the gel tube about 1/2 inch above the eye and apply the recommended amount of drops or ointment. We say 1/2 inch because if you're any closer, you run the risk of actually infecting the tubing, which then isn't really helping because that's just adding bacteria back into the eye as you're doing the procedure. All right, guys, that is what I have for this week. Please make sure that you read through your chapters before you do come to class, or do your mind tap activities. The other thing is I want to remind you to make sure that you're doing your lab notebooks. And remember, lab notebooks are not just printing off materials from your online classes. You actually have to do some of the readings and actually make notes on the readings. If you have any questions, guys, please let me know. Otherwise, I look forward to seeing you Wednesday morning. Bye, everyone.